Hello and welcome. We are going to be doing a little bit of an enhancement on a tear trough for this patient. She has previously had heavy filler placed in the cheeks. As you know, prior to doing tear trough, we should always be correcting volume loss in the midface. And so we have already done that with a heavy type filler placed deep on bone. And now we're coming back. She's had under eye filler as well, but there's a couple of areas that she still sees, especially when seen in a picture or a photo, she notices it. And so we are using a medium type filler in this area. And I'm going to be using a cannula for this procedure. Cannula in the under eye is a great tool because it is blunt tipped, so you're not going in with a sharp needle in a very delicate area. So it tends to be safer and also will minimize the risk of bruising as compared to using a sharp needle in a very delicate vascular area. So I initially numbed the patient with lidocaine, and now I have taken my entry point needle just to create that point that we're going to use for our cannula to glide into. And initially we're going to address the lateral tear trough. She sees a little bit of deficiency in there that she would like to be addressed. And so you can see here, I'm just using that entry point to advance my cannula just along that lateral tear trough. You can see my depth there is in the dermis, but definitely mid-dermis, not any deeper than that. Again, because we're using a medium filler, and if I placed this deep, you're not really going to see it. Your heavier type fillers, you're going to want to place deeper. And in this instance, we're going to be a little more superficial than what we were with her previous treatments. And so you can see here, I've got my cannula exactly where I'd like it, and I've initially aspirated. Even when using a cannula, we always recommend aspirating prior to injecting, just to make sure that you have no positive flash of blood, which might indicate that you're in a vessel. Of course, we all know that aspirating is not a guarantee that you're actually not in a vessel, but at least I know that I'm being as safe as possible for this patient, and I can keep her safe by at least attempting to aspirate. And so once I've done that, then I'm going to retrograde as my needle slides out. I'm pushing on the plunger of my filler so that I'm placing filler in that linear fashion. And then notice here, I'm just sort of smoothing it just to make sure that it sits nicely in the tissue. And now I'm going to go towards that medial tear trough as well. So I'm using my same entry point and just going in the opposite direction to target the medial tear trough. And same thing here. Given the filler that I'm using, I'm able to go more superficially. I'm not worried about Tyndall effect here because of the product that I've used. Product selection is so incredibly important in the under eye for a couple of different reasons. Both the risk of Tyndall effect, which is that bluish discoloration that you can see under the tissue. And then the second would be the properties of the filler that pull water. So if you're using a very hydrophilic filler, it's going to pull a bunch of water. And over time, the healing process over the next couple of weeks, the patient could end up appearing very overfilled, especially if you fill to correction in this area. Then once it pulls water, then they definitely have that overfilled appearance. So tear trough is just really important to go nice and slow. Majority of the time, I split this into more than one appointment. We fill to under correction, but close to it, and then allow them some time to heal, and then reevaluate them in about a week or two. Usually give them 14 days and then bring them back. And at that point, we give more if necessary. Sometimes just that hydrophilic property of the filler will pull enough water that you will actually bring the patient back and they'll look just fine. They won't need any more filler. But in the event that they do need more filler, you can do so at that second visit. And this just prevents undesirable aesthetic effects of filler in the under eye. So we're just going to do the same thing to her right side that we just completed on the left. So again, I've given her the lidocaine. I'm using a 22 gauge needle to enter into the tissue. And then we're going to take our cannula in both directions, both lateral and medial tear trough, to correct this little bit of deficiency that she has. So again, whenever you're evaluating a tear trough area, the first thing you should be looking for is, do they need correction of their midface? As we age, we lose a lot of volume in our faces, and that's for multiple different reasons. We lose bone, our fat pads are thinning, our muscles are atrophying, our skin is thinner, and overall, we don't really have the support that we once had in our younger years. And so it's really, really important to correct that mid-face. Oftentimes, this will minimize other areas in the face that patients come in complaining of, in addition to teardrop, nasolabial folds, pre-gel sulcus. So mid-face support is really everything when you're evaluating your patients for a full face assessment. Thank you so much for watching. We'll see you guys soon.